welcome to episode 4. I'm going to be talking with Dr Surinder Arora all the way from Singapore. She is a holistic functional dentist, and we're going to be talking all about how to keep healthy teeth and a healthy oral microbiome. Hope you enjoy this one.
Yes, you were saying about the accent. Go on.
I was saying about that sounds like home.
Oh, wow. Oh,
what was it? I watched something, I think it was a little bit of what you shared with Fiona. And I was like, where is this guy from?
Is it? I don't know. Do you know what? I get mixed reviews, if I want to call it that. There's a bit of everything, but correct me if I'm wrong. So you were born and brought up in Midlands? Is that what you said?
Midlands, yeah.
Okay. And then did you move to London? Because you've got like a London accent going on. Or is that?
Yeah, it's actually, but your accent has changed now. There was something else coming in there. So I was up in Sheffield. I was up in Sheffield for my undergrad, and then I was down in London for like a few years, and now I'm in Singapore. So it's like when people here are like, you're not Singaporean, are you Australian? And I'm like, think the other side of the world. And then my skin tone, they're like confused because it's like, you like, as in people from overseas here are like white, or like, there's different Indian cultures here. So yeah, people just get like super confused. But yeah, I was just like, yeah, Omar. Are you in Birmingham? Are you?
Yeah, I am from Birmingham. Yeah. Interesting enough, only the Londoners can actually pinpoint that I'm from Birmingham. Yeah, I was born in Lewisham, London for like 2 years. So
okay, yeah, I mean that's like
Londoner. That's my
minimal time to develop an accent. Yeah,
literally minimal. But I don't actually know where my accent's developed. No idea. I know when I went to uni, there was a lot of Londoners there, and like,
yeah,
what tends to happen, I don't know if you've seen it yourself. I've seen like when people go to uni, their accents change depending on who they're surrounding with, and it did change. And then I was like, then I heard myself, I was like, why am I talking like this? Like,
who am I?
Yeah, you know that Jackie Chan movie, Who Am I? At the top of the building. At one point, I was like, what is going on? And then I see other friends from college who went to uni, and they've come out with a different accent. And I was like, what?
Yeah, definitely.
And they're in complete denial. They're like, what? This is our accent. So
they're in denial. But when you go home, so like, wait, I don't know if you have this when you were at uni, and then when you went home, it was like, oh, your original accent just came back. It's like, when I go home, it comes back. People are like, where have you been? Like,
Surinder, thank you so much for coming on my show. I really appreciate it. I really enjoyed your webinar the other week. I thought when I watched it, I was like, oh my God, this would be perfect to discuss that amongst other things about the current season I'm talking about, which is how to bring up a healthy child in a toxic world. If you could introduce yourself to everyone, all the listeners out there, who you are, what do you do, where you're from, how you got to where you are.
Yeah, totally. Thanks so much for having me here, as I've said already, and thanks for joining the webinar the other week as well. So my name's Dr. Surinder Arora in this space, and so I'm originally from the UK, and I'm currently based in Singapore, and my kind of work that I do is as a holistic dentist, meaning I kind of take a whole person approach to oral healthcare. I've done some extra training in like nutrition and airway and development, and I became a certified health coach a few years ago as well. And I've also explored stuff like Reiki and Kundalini yoga, and done like further training in these areas. So dabbled in the energetic arts as well. But my main role at the moment is as a dentist, and I totally love what I do. I've also done stuff in like the public health space and mental health space, which is super interesting, and the stress aspect and how you can bring that into the clinic. So that's where I'm at right now. But I have to say it's been a phenomenal journey. Kind of a journey of like, when you're 16 and you're deciding what you want to do. Like 16 is like super young to have to decide this. I did work experience at a few places, and I went to my local dental clinic. And there was this woman there, and she was like super well presented. She was coming into the clinic, she was doing her thing, she was clocking off at like 2 o'clock. And I was like, this could be quite a good career choice. She's doing her thing, she's serving, and she's got this flexibility for like, when you have a family, all this kind of thing. And I recently spoke at a young dental conference in Singapore. And I was like,
you posted on your Instagram, didn't you?
Yeah, I'm so inactive on Instagram. You'll have like a spurt of like 1 or 2 months, and then there'll be like a desert of 6 months. I'm in a spurt at the moment, so yeah, you can catch me on there probably about another 4 weeks or so. But yeah, I was just like, I'm living that reality now because of a decision that I made when I was 16. It's like totally nuts. But anyway, thereafter, it was like law, dentistry, exploring all these kind of things. Went to dental school up in Sheffield, doing like dentistry. And it's kind of like, I kind of was just on track, like everything was going great. But I was like, something's kind of missing here. Like, I feel there's like more to the puzzle than just this aspect. So I kind of like went exploring. It was kind of like a spiritual journey as well as a deeper dive into like various aspects of healthcare. And that's when I did like further training, exploring, and kind of ended up, instead of kind of branching out and working for an NGO with the public health or being a certified health coach, I ended up bringing everything into the clinic. So it's pretty cool because it's just like so many different aspects. And this is who we are as people. We're just like multidimensional. There are just so many different aspects to us. And for me as a dentist, it's like when I look at someone, I can look in their mouth, but there's just so much going on just by looking inside their mouth that I can see, we can talk about and I feel into. So that's how I got to where I am. And Singapore was like, I want to work abroad. Maybe it's going to be Australia.
Why Australia? What was initial thought Australia? And why was that?
It was an initial thought. So like as an undergraduate, it's like you have like different opportunities. And I remember at some of the British Dental Association fairs, there'd always be somebody there from Australia. So it would be like, oh, this could be like something pretty cool. I'd like to do this whole year thing in Australia, then come back. And I went to Australia and I liked it, but I thought, I don't know if I can live here. It's a little bit too far away from home. And I literally applied for a job. I was struggling a little bit in London. I did like hospital jobs in London. I was working in private practice. I worked for the NHS. And then I was looking at other options and I applied to Singapore and I got offered a job. And then I was like, oh, okay, let's try it out. So I've been here now for like 7 or 8 years.
Wow. So something must be going right over there for you to be there for a while, right?
Yeah, totally. I mean, it was like a year is good, turned into 2 years, 3 years, 4 years, and still here now. So, but I feel very grateful. I've had some wonderful opportunities here. It's been great for self-growth and development and studying. And I have to say, like my boss, the company that I work for, have been so supportive of my ideas for the clinic. Yeah. So it's super cool.
Yeah, because that's interesting because when I spoke to a dietitian a couple of years back, she was saying to me that she's got other ideas that she's seen somewhere else and evidence for it, but because it's not under the syllabus, under the NHS, they can't do that. So, and for that reason, she said to me that she's planning to leave to start her own thing. So it just, so is that what it is? Is it seems to be a thing of where you're kind of limited to what you want to do?
I think it's really difficult working in a healthcare system like the National Health Service because I've worked for the National Health Service and it is super wonderful. And for people, it's really amazing when you go to other countries and countries don't have that. They don't have that healthcare, which is like meant to be free at the point of contact. And I know for dental services, you have to pay a little bit, but you go to your GP, you don't pay anything. You just go. Like, where does that happen? Like here, a lot of it's private, or you have to pay a little bit, or it's insurance-based. So I really feel it's like a big privilege, but it's hard. It's underfunded. You know the state of the NHS. It's tough, and it's tough on the ground as well. Overbooked, you're overworked. They're long hours. So to bring in anything vaguely different or kind of not in a protocol or something that you're super passionate about, it could be done, but it's not really when you've got 10-minute appointments, the space to do that. So this is like where people kind of think, okay, maybe like a branch out and we go privately and we explore this. And people do want it. people are super curious. People want to know like the alternatives of their health as well.
Yeah.
So I think it's a really cool thing that the dietitian colleague has done. But it's tough in different systems, and it's also finding the right fit for yourself as well, because not everywhere is going to be the right fit.
Hey guys, I want to thank my sponsor for this episode, Wellfinity. They're a full-service business improvement agency with a corporate focus on wellness. They are fantastic, so helpful, and you should check them out on Instagram and on their website.
Yeah, because like you said, your journey, it seemed like you said, it kind of like everything fitted into place. Like you were going on a trajectory where it's like slowly you were going to dentistry, and then you had all these opportunities. And sadly, that doesn't happen for everyone, does it?
It doesn't. It really doesn't.
What is the difference between holistic dentistry and conventional dentistry?
So I'd probably say it's not like a huge difference. It's more like, for me, when people ask me this question, it's more like an attitude towards dentistry. So it's like my belief system and the way that I look at people is like whole person. So when I see you, you will get a lot of questions asked from me about all aspects of your life, including, do you meditate? Do you have a partner? Stress levels, sleep, like the lot, all of it. I want to know everything. And I take all of this into account. I don't tend to just jump in and look inside the mouth straight away, because there's a whole person that we're managing here. Again, in systems like the NHS, you totally don't have time to do that. I've got a 15-minute appointment. I do not have the time to sit with you and to discuss this for 45 minutes. You're in pain, I've got to see you, and then we've got to kind of get you out of here and then see somebody else. And that's nobody's fault, it's just what the system is. So this is like the mouth-body connection. Okay. It's like, and it's not just the body, it's like the whole person, the physical, the mental, the emotional, the spiritual. This all connects back to the mouth space. And if you think when you're eating, like this is the first point of contact for your food to go into your body. If you're mouth breathing, which I hope you're not, air can come in and out of it. We'll
talk about mouth breathing in a minute.
We'll talk about this in a moment, but it's like the gateway to the rest of the body. You may hear the terms biological, integrative, functional. For me, it's like looking at the kinds of materials that are inside the mouth. Are they toxic materials? Are they not toxic materials? There's a lot of talk at the moment about amalgam. There has been for years in the profession. And even the WHO and FDA recognize that it is a toxic material and it's in people's mouths. So that's like, wow. Yeah. Right? It's like when people come in to see me and they've been referred by a functional doctor or a nutritionist or naturopath, they're like, hey, I've got breast cancer and I've got amalgams in these teeth. And you're like, when you look at the connections to the body, you're like, wow, okay, let's see what happens here. So you've got the materials, you've got the nutrition, as we've touched upon vaguely, airway breathing, growth and development, microbiome, and then like the connections of like different aspects of the mouth to the rest of the body as well. I'd also say like there's this like society factor. So thinking about society, where you are in society, what your job is, because when you smile, if you're working with people, this is unfortunately the world that we live in. We are brainwashed, for want of a better word, to how we should look and what an ideal is. So it's typically like a nice, white, bright smile with straight teeth. I'd say the straight teeth thing is probably more of kind of like a primal intuition, because we know straight teeth means like good airway, good development, good health. But you know, that white smile, like not everyone's teeth are white, like, but we judge each other. That's what we do. Like, we
and then seems like there's pressure, peer pressure, or that feeling of, oof, my teeth doesn't look as good as Simon Cowell's, so maybe I should go to Turkey, pay a bit of money. It's interesting because I had a family member who went and got veneers, and I saw the video of what they did before he actually put them in, and I was like, what is this? He looks like the Tasmanian devil who's just been punched in the teeth, and it's just all shattered. So So, what's that all about then? Just if you could just spare a little moment about that, veneers, because I was just curious about that, like having to drill or file the teeth until there's nothing. Surely there's got to be something long term about that. Like there might be issues, no?
Yeah, totally. So everything we do in dentistry, if we're providing some kind of treatment, if we're picking up a drill to drill into the tooth, it's going to not be reversible. So the second you drill into a tooth, we cannot reverse that. And veneers, for people who are not so sure about what we're talking about, it's that kind of like a fingernail ceramic or dental composite kind of cover that go over the teeth on the outside, usually for aesthetic purposes, to make the teeth look specific, like shape or color. And sometimes it's like the teeth haven't developed fully, so it's to make them just kind of look better. However, you can do, they're called minimal prep veneers. So it's just, you just kind of like take off a little bit of the outer enamel to make space for the material. Yeah. But sometimes the preparations can be heavier, meaning we remove more enamel and more dentine. So that's the second layer of the tooth, yeah, in order to make space for the ceramic or composite. So what you might have seen were either veneers or crowns on the front teeth, and they've been really shaved back. Now, one of the things and one of the risks of this is because they've been shaved back, it's closer to the nerve. So there might be some sensitivity afterwards, and the nerves may be affected in the long term. And that is just one of the risks of the procedure. I have many patients that have veneers with no issue, but it is one of the risks of the procedure.
And how does the nerves affect us in the long term then, or if something were to happen? Because obviously you said the teeth are connected to the nerves. And I've seen like diagrams where it shows you the nerves connecting to everything. So in a holistic sense, then that could affect what other potential diseases?
So the nerves of the teeth, you have various nerve systems in the body. It's more of an energetic connection, I feel, is what you're talking about with energy lines. So you may have heard of chakras. They're the kind of the big energy centers that we have. And for some people, it's like, I totally don't believe in this, and this is not something that resonates. But for others, you might be like, oh, that's interesting. And then if you've heard of like acupressure or acupuncture, we work with like tiny little energy centers all over the body, or your teeth have these, they're called meridians, your teeth have these as well. So injury to a tooth in this way, or putting a toxic material on this kind of energy line can affect the rest of the body. And I'm not saying that it will, I don't know how it will, but there will be some disruption. It's like a little blip in the circuit is how I describe it. How that plays out for each person is very, very different. Correct. But yeah, I mean, you kind of want to keep your nerves intact in your teeth for as long as possible.
So what common issues do you see in like society or in your practice with children? Because I can see one child has crooked teeth and the other child hasn't. So I'm just curious to know, like, what do you see what do you see anything like similarities or common in practice or in society, like why that might be happening?
Yeah, I mean, crooked teeth is massive. I'm seeing more and more crooked teeth, more and more mouth breathing. And it's also interesting between siblings, how one sometimes has it and the other doesn't have it. And there can be like a ton of reasons for this. We can talk more about that in a moment, coming back to your question. Yes. So other common things that I see, dental decay, this is like super common. Loads of reasons for this as well. Bleeding gums, tooth grinding, mouth breathing, snoring, ulcers in the mouth, kind of dental trauma, somebody's like knocked a tooth. And I believe in the UK, the stat is like 1 in 4 kids have dental decay, which is like, it's a lot.
That's a lot of kids.
It's a lot. Like when you do look at the evidence and the research, it's like, and a lot of it is actually, I think, undiagnosed. Like, I think for a lot of people, yeah, like, I think it's less than 50% in like between 2020 to 2021 of people saw an NHS dentist. People might be going private, but it's like, where are all the other kids? Like, what's happening in their mouths? So a lot of this has got to do with diet and nutrition, absorption. So I actually have a lot of kids coming in with food allergies now. I don't know if you're noticing this.
Yeah.
Like a lot more than.
It's because the chemicals are added outside in the food, and our bodies are just not it's just alien to the body. So seeing with clients as well, hardest thing I find is people committing to a way of living, and I feel like it's because they don't really understand why they're eating a certain food or why they're taking this out. Do you see that in your practice?
As in understanding like
Benefits.
why they need to eat. Yeah.
Yeah.
So yes and no. I see different groups of patients, like different groups of people. So I'll see like for general consultations. I still see general consultations, and these people don't really want to know anything vaguely outside of, can you clean my teeth, please? And I'm like, that's totally cool. So it'll just be like, I'll mention like vitamin D and kind of weave a little bit in, but we don't kind of deep dive into like fat soluble vitamins so much. I do generally mention it to everybody, but for some people it's just like, I'm gonna go and leave with my Coke now. But for other people it's like, tell me everything. They're like,
I want to know right now.
I want to know everything. So it's I feel there's a growing awareness. I feel that the internet and people speaking out has really kind of propagated this, because like you've got just so access to so much information now. But on the other hand, like it depends. Like some people are just like, I don't care, or they're like, yes, and they're like, gonna change the habit, and then they go away and they do it for a bit and then they just fall off the bandwagon again. But it's because they don't have support. It's like anything. Think of like gym. You need a personal trainer. You need sometimes, if you're not so motivated, which is totally fine, you just need someone to hold your hand. This is, you just need like that kind of support. But it's for me, what my experience is mixed, but also I feel people come and find me for like holistic dentistry. So they are also more like, I want to know everything as well. So it could just be that kind of gravitation.
So mouth breathing. I suffer from mouth breathing, unfortunately.
Yeah.
And to be honest, sometimes it's because of, I feel like it's because my nose, it's hard to breathe from my nose sometimes. But consciously I try. I know that I've haven't been mouth breathing because my mouth ain't dry in the morning. Like you can feel it's moist.
Okay.
So after watching your webinar, correct me if I'm wrong. From what I understood is you said something that the tip of the tongue have to touch the back of the front teeth or something, or just before, and hold it on top or something like that. So if you could just explain all about mouth breathing, the issues with that and how it can be fixed, or if it can be fixed.
Yeah, absolutely. It is like super common. I would say like every other person I see is a mouth breather, and that's adults and kids. Yeah, where do I even start with mouth breathing?
I can imagine.
So it's basically a development issue, and it starts like even like pre-birth, I would say, with like the microbiome situation, mom's health, but then kind of passing through like the vaginal canal, depends on the birth, and everyone has a different birth experience. I'm talking about the bacteria inside the mouth right now, the oral microbiome, and the development of that aspect. So how we're born, how we come through, position of the head, position of the jaw when we're coming through, and how we're passing through. So there's that aspect. And then there's breastfeeding. So breastfeeding is massive. And again, as a mom, like everybody has their own breastfeeding journey, and it's not easy. Some people, right? You have 2 kids and you're a dad. It's like, wow, like this is right.
Yeah, when you have 2 options in front of you, where you have breastfeeding, you're literally on tap any time throughout the day, and then you have the option of bottle feeding, where it's fixed. Then the temptation is there. But it all comes down to the person, and like you said, the journey is different for everyone. And I'm grateful that me and my wife, we went to a breastfeeding classes with the NHS. Before the pandemic started, we went to all the classes, and it helped out a lot. And they're quite good. Like they give out numbers where if you're stuck, give a call. And I think sometimes it's frustration, and I can understand the frustration as well when they're not latching on, or nothing's coming out. It can be frustrating. It's hard work. It's not easy. The benefits are just unreal, right?
The benefits are unreal. But it's, yeah. So if you can breastfeed, if you are having a baby and you do have the capacity, I strongly urge you to really explore this as an option for as long as you can, because loads of reasons, but from a dental perspective, the tongue pushing onto the palate, it helps to shape and form the palate so it becomes wider and more developed. To get the milk out of the nipple, the tongue has to go up and press against the palate. You don't have that so much with a bottle, so you don't get that development. Wow. And breast milk is a superfood, and it's what we were designed to drink. So that's the first thing, is if you can breastfeed your child, do it, like if you can. And yeah, we're in a world where women need to go back to work and all the rest of it, but you could kind of do both, or whatever works. So that's the first thing. And then it's like nutrition, our soft diets. And now we're talking like agricultural revolution, industrial revolution. You may have heard of Weston A. Price. This is all of his work in the 1930s.
Love their work, yeah.
You just like check that out, read the book. It's pretty heavy, but it's super interesting. It's what we're eating. It's our nutrition, mainly, more than anything else. And through the generations, things are getting passed down and passed on. We're not using the muscles anymore as much as we were. So when you're chewing, so like when you're going to the gym, when you're chewing, you're using muscles, and these muscles tell the bone to grow. If they're not being used, we're not getting the growth in the areas. The other aspect is like stuff like tongue tie. Where's your tongue sitting in your mouth? Is your tongue on the floor of the mouth? Is it on the top of the mouth? Are the lips together? Can we breathe through the nose? Do we have allergies? Do we have mold in our space? Are we reacting to something in the environment? Are there anatomical issues from growth and development? So all of these things can lead to mouth breathing. It's multifactorial. And when we kind of look at this at the clinic, it's like, have you seen an ENT, an ear, nose, and throat specialist or surgeon to get kind of anatomically checked out? How long were you breastfed for, and what did that look like? What's your diet like? Are you getting good nutrition? Are you getting your fat soluble vitamins, A, D, E, and K2? Are you eating kind of a whole foods fibrous diet? For most of us, it's no. That answer is no. It's just not there. And even when we try, right, I'm going out, I'm getting my organic food, I'm doing this. Actually, the nutrient density of what we're eating now, I don't even know what it is in comparison to historically. I don't even know.
My mentor always tells me that you would have to have 4 carrots now compared, and that's the same as having 1 carrot 50 years ago. And I think it's probably less now. That's crazy. That is crazy.
Crazy.
And because of that reason, because of the nutrient density has got less and less, we're having to, in the UK, as you may know, is they recommend 5 a day, but I say to my clients, it's actually 10 a day, because that's just to cover your basis, because the nutrients are just it's just not enough. It's just not enough anymore.
Yeah, absolutely. I mean, we're just not getting what we need, but we're all still here, so that's good. So on the nose breathing and mouth breathing, so when we nose breathe, we kind of get this warming and humidifying of the air that comes in, and it allows the air to mix with nitric oxide, and this increases the oxygen intake into the lungs. Okay. So this is quite important because it's helping oxygen get around the body. Wow. When we're mouth breathing, we're getting this dry, unfiltered air and no nitric oxide. So we're basically depriving ourselves of oxygen. And oxygen is the #1 nutrient. So it's free. And it's free and it's there. And this is it's going to affect the posture. We're going to be like leaning forward to get air in. You're going to have a dry mouth. You're going to be more susceptible to dental decay, periodontal issues, gum issues inside the mouth. yeah, look, and there's like the whole like sleep apnea and like all this other stuff going on. But in kids, like I'm seeing them, they're coming in, they're tired, they have a poor posture, bedwetting, ADHD, trouble concentrating, like all these kind of things. So it's like we have a pandemic of mouth breathing, and it's really serious. It is really serious. And when people come to see me, I'm like, right, this is what the picture looks like, and we need to do, if you are open to this, we need to do something now, because this will be setting the child up for life.
Yeah,
good option.
Definitely. And I also noticed from other holistic dentists or functional dentistry on Instagram and other social media posts, they put an image of like someone who mouth breathes and someone who doesn't, and like it's on the side, and you can see like the jaw is kind of like, I don't know if it's lowered. Is it lowered or is it higher?
It's like,
yeah,
kind of back.
It's like the chin has gone like that.
Totally. Yeah. So it's like back. Just like that. So yeah, that's what it is. Like you have this going on, and it's super common. I used to be a mouth breather. It's basically training the tongue to be on the palate, lips together, breathing through the nose, and it takes effort. It takes effort, and there are appliances that can be worn to help. You wear it at night, you wear it in the day. There's a whole program. You do exercises.
What is that called?
Works. So it's under the bracket of myofunctional therapy. There are different appliances. There's like MyoBrace, I think Healthy Start is another one. There are loads available, but definitely look into it if you ask your dentist about it, because it could change your kids' lives.
Would the conventional dentists know about that, like NHS? Would they know about that?
I don't know.
Okay, but it's not harm in asking.
Yeah, just ask, and it might even just bring awareness to the dentist. And they were like, "Oh, hey, this is actually quite cool, and maybe we can do this privately," or what that might look like. So, but yeah, I think that is super important. I think it's something that we need to address. I don't know if the dental profession is doing like a great job at it, but there's definitely growing awareness, which is awesome.
Great. There's some controversy with fluoride, and I've read your blog post on your website, which I found interesting. And so what is your thoughts on fluoride then?
So fluoride is used in dentistry. It's accepted by the profession to reverse decay in teeth. As a preventive measure. So it's super common. You'll go to your dentist, you'll have your teeth cleaned, and they'll say, would you like a fluoride treatment? And you might not even know what it is, and it's free or it's part of the package or whatever, and you just do it. But it's generally what's in everybody's toothpaste. If you use a conventional toothpaste, we have like 1350 to 1550 parts per million fluoride in our toothpaste. And this is, the idea is to help fix holes in teeth, to reverse dental decay. So that's why it's there. There's a ton of evidence for it, and it does do this. So it kind of combines with calcium and phosphate in saliva and teeth to form fluoroapatite, and it kind of covers the demineralized areas, so those areas that are kind of getting weaker, to kind of fix or remineralize the teeth, and that's what it does. However, there is a large body of evidence to suggest it has other effects in the body. And if you're super interested about that, just punch it into your search engine, you'll get loads up on it. And I do urge everybody just to do your own research on anything you're putting into your body, particularly your mouth, because anything you put into your mouth is getting straight into your system, because the oral mucosa just absorbs. So it's just going, and whatever you're brushing with is going into your system probably twice a day if you're brushing twice a day. So just do some research on it. But it's used in dentistry. Pretty much the majority of dentists I know use it, and it's accepted by kind of all the professional bodies like around the world. There is an alternative, which is a growing body of evidence called hydroxyapatite. So this is like a form of calcium, Hydroxyapatite makes up about 90% of the enamel. So you have 3 layers of the teeth. You have the nerve in the middle, you have something called dentine, and then you have the enamel. The enamel is the stuff like when you smile, Omar, that's what I see. I see your enamel, hopefully. Yeah, there we go. So that's the stuff that we see. It's like the hardest substance in the body. So it makes about 97% of enamel, 70% of dentine, the second layer. So then it kind of is absorbed by the teeth and remineralizes, so reverses that process from the inside out. There is evidence for this. I think Limeback et al. In 2021 published a systematic review. So you can kind of look into this. And it kind of said that the HAP, the hydroxyapatite, is effective at reducing dental decay, especially in children. And there are quite a few studies coming out now saying that there's no real big difference between the fluoride and the hydroxyapatite. As far as I'm aware, the hydroxyapatite doesn't have any systemic effects, so other greater effects in the body. But again, check in with that for yourself and have a look at what's in your toothpaste. Like, if you're somebody who reads ingredients lists, if you're curious about what's in your food, if you're curious about what's in your shampoo, like this kind of thing, be curious about what's in your toothpaste as well. Turn it over, have a read, and see if you recognize some of the things that are in there. For me, I don't recognize many of the things that are in there. So then I think, do I want to be putting this in my body, particularly in my mouth? And then you make your own decision from there.
It's interesting you're saying about the fluorides remineralizing the teeth, right? So is it correct in saying that sugar will basically eat up the calcium from our bones? Is that correct?
So what the process generally is, so it's super complex, and I'm going to try and simplify it. So it's like, traditionally we would say like the sugar and the bacteria come together and create an acid.
Right.
And when you have a pH that's acidic, more acidic inside the mouth, and this can be for a lot of reasons, then you start to get the holes, the cavities developing in the dentine. Dentine's softer than enamel, so sometimes that goes first, so we can't see anything. But it starts to basically eat away through the tooth. However, if you have good kind of like fat-soluble vitamins, A, D, E, and K2, and the body is kind of like super healthy. It's like sometimes I see people that eat so much junk and they have no cavities, and I see someone who's super healthy and they've got loads of cavities. Wow. So it's like, it's not just as simple as that. There are many factors, but yeah, I mean, you can totally share this with your kids that you're about to eat junk and this is not food. It's not food.
Bless them. They do. Yeah. I know I'm saying all these things, and bless them. They do say, like Lana, my youngest, she's like, is that healthy though? Is that healthy? Bless her. She's only 2.
I mean, like, yeah, they are. Like you.
It's like you're trying to think of how you want to word it the best way possible, right?
Everyone has their own way, and I think like it's totally cool whatever you're doing. But you're right, it is about balance. Like we have fruit like kind of as a treat, so it's kind of like, oh my gosh, give me those strawberries kind of situation. Yeah. Or like we'll have like a cashew nut butter with like some lemon and some coconut. Like this is dessert. Like, So we go to a birthday party and it's a standard birthday party. Can I have some cake? Yeah, like have a little bit. So it's all like, it is all about balance. I definitely think it's all about balance, and it's different for every family.
Yeah, I mean, the dessert, one of my favorite desserts I make for my kids is raw organic milk mixed with cacao powder and raw honey, just a little bit, and I blend it, and I just think it actually tastes like chocolate milkshake. It does. And I just think, do you know what? This will be my saving grace because they love it. So
this is great. Like this is like getting super creative with food, and 100%. Like stuff like popsicles, like maybe like some like coconut milk or yogurt or whatever, if you have lactose, like mixed with some like berries, like it's just, and they're just like, oh my gosh, ice cream. So it's like, yeah, like you don't. And then the thing that happens is, from what I've noticed, is that the taste buds are just like, when they have something really sweet, it's like, that's like too much. It's like, and I know, like, there's this study in rats done about like the cocaine and the sugar, and the rats go to the sugar rather than the cocaine. But there's definitely something to be said for the taste buds. Correct. Because if it's too, even for me, like if I have actual sugar, I'm like, whoa, like
you just know it's too much, don't you? Or is that just me?
No, it's too much. Like I can't take, and I have a hangover after. Like it's like your body just becomes insensitive. But as you said, it's all about balance.
Could you give examples of vitamin, like food sources for A, D, and K2 that you mentioned earlier?
I can't. Well, it also depends. So a lot of it is like fish, like oily fishes, like this kind of thing. Like your seeds, like nuts. But a lot like eggs is another. D, like sunlight, like looking at this kind of thing. But the thing is, like if you're vegan or vegetarian, it's like, oh hey, so like what do I do? Because a lot of it is like, if you look at Weston A. Price's work, it's like, what were they eating? They're eating liver, they're eating like organs, they're eating all this kind of thing.
Was it Price saying that he had something about vitamin X? Was it that K2? Was that what he said? Right. Okay. So that was the vitamin that he thought that was like did he say he wasn't sure what it was, and then he worked out it was K2?
Yeah, like the activator. I think he was calling it, something like this, X, activator X or something. And this is the one that helps the calcium go to the right places in the body. So they're like super important. But sometimes we need to supplement. So a D3K2 is like one of the ones that I'm like, get your vitamin D checked. Like this is like,
that's what I say. Yeah, like people ask me, oh, how much should I take? I was like, it would be irresponsible for me to say take this much. You need to go and get tested and come back and then let me know, and then we can sort it out. Because I think if you're not experienced or don't know enough, then you can cause issues to trying to do the right thing, right?
No, you don't want people to be like overloading on vitamin D. I mean, I don't think I've ever met anybody who's got super high vitamin D levels. They're like, it's usually like in the 30 or even lower range. Wow. And if we're trying to bump it up to 50, like even for like dental surgery, it's like, hey, have you had your vitamin D checked? Because it's like, amongst other things. Healing, like for healing, it's like super important, like your immune system, it's super important. So yeah, I always recommend like get levels checked before you start supplementing as well. Because people also ask me, they're like, so how much should I take? And I'm like, we really need to understand where you're at before we start supplementing.
Great. Oil pulling, what do you think about that?
Yeah, I mean, recently there's been more kind of stuff coming out about it. It's an ancient Ayurvedic practice where you swish oil, maybe coconut oil, good quality oil, please, inside the mouth for like 20 minutes. It's a long time. And then it's a long time. And then you spit it out. I always advise put it in the bin, not somewhere else, because it's going to clog the sink. And it basically pulls and cleans out like bacteria, freshens breath, alleged teeth whitening. So yeah, I mean, a lot of my patients do it, but not for 20 minutes. A lot of them just do it for like 5 minutes.
It's tough. It feels like it's forever. I'm not gonna lie.
It's forever, and then it gets really thin inside the mouth, and then it's like, okay, 20 minutes. But if you have time and space for it, I mean, why not? There's evidence for it. So it's like preventing decay, decreasing bacteria, reducing gingivitis, reducing bad breath. And I've seen people tell me.
So should you do that before you brush your teeth, or after, or before you tongue scrape? Which one's first?
Yeah, so people always ask me this question.
I usually do it the first thing. I do that first, and then, no, sorry, I tongue scrape, and then I do the coconut pulling, and then coconut oil pulling, and then I brush my teeth.
So I think that's totally fine. I mean, like, if you think you're having this oil in your mouth for like 20 minutes, so it's like, if you were to do it, and there's like a study, I think Woolley et al. In 2020, he looked at it's a systemic review. I think there was like 42 studies, 4 of which were randomized control trials, to say like it does work, like it does have health benefits. But the order, so I would personally tongue scrape, brush, and then oil pull. And the reason for that is because you're going to have bacteria sitting everywhere inside your mouth to start with. So it's like if you're pulling, so it's like
finish it off with pulling, right?
Brushing, yeah, get all those last bits out. But you can totally do it. I mean, if you don't use like a conventional toothpaste, or you don't use a conventional brush, you can like do the scraping and the pulling. But there is something to be said for the manual removal of the plaque. Like if you like run your tongue over your teeth in the morning, sometimes it feels a bit furry, sometimes it doesn't. If you're mouth breathing, it might feel super dry, but there's just like a massive load of bacteria there, like just hanging out. So if you're pulling and, you know, then this is all bacteria going round and round and round inside the mouth, how does that feel to you? So I guess you kind of like find your way with that.
Right. Tongue scraping. So I tongue scrape. I find it brilliant. Like, you could actually see what's coming out, which is great. Yeah. But can kids tongue scrape? Is there a kids version? Because my daughter's looking at me, is like, can I do that? I was like, I don't know. I don't know if there is a kids version of a tongue scraper.
I don't know if there's a kids version. I don't see any harm in scraping the tongue for kids. Like some kids I see do have a coating on their tongue, but sometimes it's just indicative of like a gut issue. Like it your tongue tells stories for sure. I don't know.
Is that like candida with the tongue?
Can be candida as well. Yeah, there's like loads of stuff that can hang out. Imagine your tongue's got like these tiny papillae on those little grooves all over the tongue. Yeah. Your plaque can get stuck in your tongue as well, and then it just builds up and you've got this layer on there, and it can be like exacerbated by different issues going on in the body. But I don't see the harm in kids. I don't know about a 2-year-old. I mean, if you've managed to brush her teeth, I'm super impressed. Twice a day, that kind of thing. But they're super curious. Like mine's like, I get my mom out and he's like, can I have the floss? And I'm like, yeah, you can hold it and like play around with it. But I don't see any harm that could be caused from like taking off the plaque. I don't know about sizes. You'd have to kind of have a look into that in a bit more detail.
Okay, great. I've never seen anyone talk about a miswak. So do you have any thoughts about a miswak? Because culturally we're told that it's really good. But I've never seen anyone talk about it. So I'd love to hear your thoughts about that.
Yeah, totally. So I've not tried. Actually, it's interesting you've mentioned this because I have actually ordered some to try out.
Oh, wow.
So I was super curious about it. This was a couple of weeks ago. So my understanding is it's from like an arak tree. So it's a specific tree and it's got like some really great antifungal, antibacterial properties. It's like a chewing stick. So I think traditionally it's been used as a chewing stick. And I do believe like the Prophet Muhammad was like, yeah, like this is like a really good thing to do for oral hygiene. And when you look back in history, let's face it, no one had like a Colgate toothbrush, like
electric toothbrush or what do you call it? That water sprayer thing where it just blasts like
no one had any of this stuff. So it's kind of like, nylon toothbrushes with plastic handles, like all of this stuff is like super new. It's all really, really new stuff.
It would be interesting to see what did Dr. Price say about the African kids that he saw. Did they use like a stick or anything, or a twig or anything, or did he mention that in his book? I'm just curious, actually.
I can't remember. I read that book maybe about like 10 years ago.
Okay.
But there are indigenous communities that use chewing sticks, super common, across all areas of the world. Some use nothing, like totally nothing. And it just kind of goes to show they would have like staining built up on their teeth, but it would just be like no decay, well-formed dental arches, no crooked teeth, all this kind of thing. So yeah, I mean, like I feel that I'm going to give it a go myself just to see, but I don't know if it's a bit abrasive for the tooth surface. So what I mean by that is it going to cause too much pressure on the tooth surface? Now, when you're brushing your teeth anyway, sometimes we can put too much pressure on there, so it wears away.
I always tell that to my kids, my eldest, don't press too hard. You just want to brush it. You don't want to, because sometimes it feels like she's so eager to do it. She's like, but like you said, like don't put too much pressure, right? Because you could actually damage your teeth.
Yeah, and the gums, you can get gum recession as well. But I think if it's used, as far as I understand, I really don't see the harm. You don't need toothpaste for that. You don't need water to use it. So I'm super curious. And there's so much good stuff in nature. There's so much good stuff in nature. But I mean, the other aspect is, which is more important, is what are you eating?
Yeah.
Because if you're a mouth breather and your diet is like basically like refined junk food.
Yeah. The pizzas, the soft white breads, like the white foods, they convert to sugar, right?
Yeah, your white flours, all this kind of thing, sugars. It doesn't really matter what you brush with so much. It's more of like a breath freshening, and yeah.
This is a quick fire round.
Okay.
Quick fire round, yeah. You've literally got a split second to answer, all right?
Okay, go.
Okay, ready? Guilty pleasure.
Nut butter.
Favorite thing to do?
Hang out with my son and husband.
Favorite destination?
Oh, it's really hard. I'm just thinking the Amazon. Amazon came to me. I don't know.
Have you been there?
Yeah, I've been there.
Oh my gosh! Wow.
Yeah.
Right.
It just came to me. Just like the dark night and the stars in the sky. Like amazing.
Amazing. Hobby outside your job?
Kundalini yoga.
Oh,
yoga.
Interesting. So what is that like then? What kind of yoga is that then?
So it's more like, so it uses body posture, breath work, and mantra, so sound vibration, to kind of balance and align the chakra systems of the body. Casual.
Could you explain chakras for a moment? Because I don't get it. I don't get it. Do you have like an understanding of what chakras exactly is?
Yeah, totally. So if you just think, this is quantum physics. So this is like all studied. Everything is energy.
Yeah.
So like the sound current is energy. You are energy. I am energy. The table here is energy. Your camera is energy. And it's made up of like vibrational frequencies.
Yeah.
Now, we are multidimensional beings, and everyone has different belief systems, but there's an energetic component to us. Like even our physical body is like, it's basically matter and energy. The chakra system, it's like, the word chakra means wheel, and the chakras sit at certain areas of the body. So you've got like one at the root at the base, one just kind of like where the sex organs are, one where the navel point is, one at the heart, throat, third eye, and the crown chakra. These link to the organs in the body. They all have a purpose for our energetic body to keep it healthy. That's basically it. And then over the body you have, and there are different kind of areas where like there's another chakra that's higher and lower, but it basically connects us to like the spiritual and then down to the ground. That's basically what the system is. They all have a color, they all have a different energy to them, but they can be balanced, and they can be balanced to help heal the system as well.
Interesting.
Probably my quick fire summary.
What would you say is the top three tips for healthy teeth?
Breathe through your nose, not through your mouth. That's tip number one. Tip number two, vitamin D. Make sure your vitamin D levels are good, getting good sunshine. This is like absolutely essential. What else? Chewing food. So chew your food. So a lot of our food nowadays is just like super soft, so we don't even get the chance to chew it.
Yeah.
Try and chew it.
But should we chew like crunchier food, like actual, like, I don't know, like hard vegetables?
Raw carrots, it's like a good example. I mean, it's hard. Like if you like looking out for chewy food, it's like, it's really hard.
Yeah,
like,
when you don't do it
right?
for a long time and you start doing it, my jaw started hurting.
And your jaw starts to ache. And it's like you go, so again, back to this example, like you work out and your muscles are aching. Like this is the workout that your jaw needs to keep the bone strong.
Great.
And develop, particularly in kids.
Great, fantastic. Top 3 foods for healthy teeth or healthy oral microbiome?
Leafy greens are good. Fermented foods are really good. good for K2. And if you eat fish, fish would be really good, like a cod liver oil supplement if you eat fish.
Great. And to finish off, what does health mean to you?
So I've said this a few times now, but we are multidimensional beings, like body, mind, emotions, spirit. So I think for me, it's like balance in all of these areas. And I think that balance is different for everybody. But that essentially is what health is, when you can thrive and these areas are in balance. Maybe optimum, but like balance.
That's great. Surinder, thank you so much for joining me today. I really appreciate you spending time with me, and all the way from Singapore. It's late there right now, isn't it? It's like 8. Is it 8 o'clock?
Yeah, it's like 9 p.m.
Oh wow!
Okay. Bedtime.
Oh, I won't hold you up any longer. Surinder, thank you so much, and I guess keep in touch, and I'll be looking forward to your post. Hopefully, in what did you say? 4 weeks' time? Did you say?
You'll probably get some posts coming over the next few weeks, and then there'll be like a drought. So yeah, enjoy. Thanks so much for having me. It was lovely chatting to you.
Likewise. Take care.
All right. Bye-bye.
Bye.